Welcome to the deep dive. Today, we're really zeroing in on a big one in data security.
Yeah, some things it's a bit of a wake-up call, especially when it's about health information.
Exactly. We're going to unpack this pretty significant health data exposure. It's connected to Catholic Health, a large healthcare network here in New York.
Right.
This is definitely something that should be on your radar.
And it's interesting because it's not just Catholic Health.
Yeah.
Right? The other player here is Serviceaide.
Serviceides. Tell us about them.
They specialize in, they call it agentic artificial intelligence for IT management. Basically, they're the IT support guys for Catholic Health.
Ah, okay. So the tech partners.
Exactly. And this whole thing really shines a light on how those partners, the ones healthcare providers rely on, can actually become weak points if security isn't absolutely top-notch.
Right. That makes sense. So our goal today, pretty simple, really. Break down what happened, what kind of, frankly, very sensitive information was involved, and why you listening need to know about this.
Yeah, the implications are pretty broad.
Okay, but before we really dive in, just want to mention that this deep dive is brought to you by Stonefly. They're leaders in enterprise storage, backup and disaster recovery, AI storage, and cloud solutions.
Good stuff.
Yeah, so if you're looking for secure, maybe ransomware-proof storage, Stonefly sells air-gapped and immutable options. Just contact sales at stonefly.com to set up a demo.
Worth checking out.
Definitely. Okay, let's get into it. So, this exposure. It happened between September 19th and November 5th, 2024. How did they even find out?
Well, Serviceaide themselves figured it out on November 15th. And what's really striking here is how it happened.
How so?
It wasn't some, sophisticated hack.
Right.
It was an Elasticsearch database full of Catholic Health patient data.
Okay.
And it was just inadvertently made public.
Yeah.
On the internet.
Public, you mean anyone could just...
Potentially, yeah.
Okay.
Think of it like a huge library of private files, and someone just left the front door wide open online.
Wow. And the sheer number of people. Over 483,000 patients. That's huge.
It's massive. And while the initial investigation, didn't find hard proof that data was copied.
But they couldn't rule it out.
Exactly. Serviceaide couldn't rule it out completely. And that uncertainty, well, that has to be incredibly worrying for everyone affected.
Absolutely. What does that really mean, that uncertainty?
The big problem. Because even if there's no direct evidence someone copied it, that window, that period was open. The possibility is just there.
Right. Once it's out, it's out.
Pretty much. It's
Yeah.
really hard to know for sure what happened. Now, Serviceaide did act fast once they found out. They secured the database, closed that door,
Okay, good.
and they launched a full investigation. They even brought in a specialist data review vendor to go through everything meticulously.
That sounds thorough. When did they get results?
They got the results back on March 20th, 2025, and then Serviceaide did more reviewing and verifying on their end. So, it shows just how complex it is to figure out the full scope after something like this.
So after all that digging, what kind of information are we talking about? What was potentially exposed? This is the crucial part, right? The potential harm.
Yeah, and this is where it gets really serious. The data is incredibly sensitive.
Like what? Give us the rundown.
Okay, so the list is long. Names, obviously.
Yeah.
Social security numbers, dates of birth, medical record numbers, patient account numbers.
Oh, wow.
And then the really critical stuff, medical and health information. So health insurance details, prescriptions, treatment info, clinical data, even things like provider names and locations.
That's incredibly personal.
It is. And get this, in some cases, even email usernames and passwords.
Wait, email usernames and passwords too?
Yeah.
That just ramps up the risk factor like crazy. It's not just health data anymore if those logins were reused.
Exactly. It could open up a whole cascade of problems across other accounts. A domino effect.
Unbelievable.
And Serviceaide did point out, the specific info wasn't the same for everyone. It varied from person to person.
So one person might have just had a name and medical record number exposed, maybe?
Right. Well, someone else could have had their social security number, specific prescriptions, really sensitive stuff out there. It makes the potential impact feel very individual.
Okay, so what's been the official reaction? What happens next after something this big?
Well, Serviceaide did a few things right away. Secured the database, started the investigation, like we said, but they also had to notify the regulators.
Right, legal obligations.
Exactly. They reported to the Department of Health and Human Services, HHS, on May 9th, 2025. That's a key step under IPA, the rules protecting health info.
And what about the actual people affected? All those hundreds of thousands of patients, what are they getting?
Serviceaide is offering them 12 months of free credit and identity monitoring. It's through Cyberscout, which is part of TransUnion.
Okay, that's something.
It is, but, and this is important, people have to actively sign up for it. It's not automatic.
Ah, okay. Good to know.
They're sending out notification letters. And Catholic Health, they put up a short notice on their website, basically pointing people towards Serviceaide's statement for the full details.
Okay. And I bet the lawyers are circling already. I saw some reports.
Oh, yeah. That's pretty standard after a breach this size. Several class action law firms have already put out notices saying they're investigating.
So, potential lawsuits on behalf of the patients.
Exactly. It's one way people can try to hold the companies accountable, for letting their data get exposed.
This whole thing just feels heavy. And you said it's unfortunately not exactly a one-off, these kinds of accidental exposures?
Sadly, no. Inadvertent exposure, especially from IT misconfigurations like leaving a database open, it happens more than you'd hope in healthcare.
Really?
Yeah, we've seen similar things before that had major consequences.
Can you give an example just to see what the fallout can look like?
Sure. Remember in Mediata Health Group a few years back?
Legally, yeah.
Similar thing. Protected health info for about 1.6 million patients got exposed online.
Wow. 1.6 million.
Yeah. And the penalties were steep. A $250,000 fine from HHS, $1.4 million settled with state attorneys general, another $1.1 million in a civil settlement.
Ouch.
And there was another smaller one, Vision Upright MRI. They got hit with a $5,000 fine and had to do a whole corrective action plan just because unsecured medical images were found online.
So even smaller screw-ups have consequences.
They do. It shows that even with rules in place, these mistakes cost companies big time and, more importantly, put patients at risk.
You mentioned HIPAA before. Quick refresher.
Yeah.
What is it? Why is it so central here?
Right, HIPAA, Health Insurance Portability and Accountability Act. It's the main federal law setting the rules for protecting sensitive patient health information, what they call PHI, Protected Health Information.
Okay.
So healthcare organizations, the covered entities, hospitals, doctors, they have to follow HIPAA. But, and this is key for this case, it also applies to their business associates.
It's like Serviceaide.
Exactly. Companies like Serviceaide that handle PHI for those hospitals are also directly on the hook under HIPAA to keep that data safe.
Got it. So what are the common ways companies mess up with HIPAA? How do these violations usually happen?
Oh, there are quite a few ways. Obviously, improper use or disclosure of PHI, like what seems to have happened here.
Right.
Also, not having the right safeguards, physical, technical, administrative, not giving patients access to their own records quickly enough, not training employees properly on HIPAA rules, not doing good risk analyses to find vulnerabilities, unauthorized access, whether internal or external, even just like failing to keep good logs of who accessed what.
So a lot of potential pitfalls. And the penalties, if they do violate HIPAA, not just fines, right?
Definitely not just fines. Those can be huge.
Yeah.
Hundreds, potentially millions of dollars, up to $1.5 million per year for willful neglect.
Whoa.
And in really bad cases, if there's malicious intent, criminal charges, fines and prison time, up to 10 years.
Seriously, prison.
Yep. Plus, civil lawsuits from the affected individuals. And HHS can force them into these corrective action plans, which cost a ton of time and money. And then there's the reputational damage. Losing patient trust. That's huge, too.
Yeah, you can't easily put a price on that. It's clear data security in healthcare isn't just some IT issue in the background. It's legal, financial, ethical.
For everyone involved, including these business associates, absolutely.
So let's bring it back to you, the listener. Why should someone who wasn't a patient at Catholic Healthcare about this specific incident?
Well, I think this whole situation really hammers home why everyone needs to stay aware of data security stuff, especially in healthcare. The info involved is just so personal.
Right.
The risk of identity theft is very real when things like social security numbers, birth dates, financial bits get out there.
So what should people do, generally speaking?
It means you need to be, extra vigilant, monitor your credit reports, watch your bank accounts closely, be super wary of any weird emails or calls, phishing attempts, trying to use this kind of leaked info.
Good advice. And the fact that class action lawsuits are being looked into, that matters too, right?
Yeah, absolutely. It's a key way to get accountability. These lawsuits, they might provide some compensation for the victim, sure, but they also push all organizations to take security more seriously.
Hopefully leading to better protection down the line.
That's the idea. They can really drive systemic change in how companies handle our sensitive data.
Okay, so wrapping this up, this Catholic health data exposure, nearly 500,000 people affected, looks like it stemmed from a serious misstep by their IT provider, Serviceaide.
Yeah, a misconfiguration, it seems.
It just throws a harsh spotlight on the ongoing and honestly pretty complex challenge of keeping sensitive information safe in this digital age we're all living in.
Totally. The sheer amount and type of data exposed here, personal details, medical records, financial info, it carries huge risks for people.
And the regulatory heat, the potential lawsuits, it all just underlines how critical it is for any organization touching this data to make security job number one.
And, thinking bigger picture, especially with AI getting plugged into everything now, including IT management and
It's
healthcare.
these service aid uses.
Right. This whole incident raises a really important question, something for you to chew on. As AI gets more involved in handling our most private data, how do we actually ensure that the security, the oversight, the accountability,
Mm.
how do we make sure all that keeps pace?
Mm.
How do we protect our data from these kinds of accidental exposures or even misuse in this evolving tech landscape?
That is a really crucial and, yeah, thought-provoking question to end on. How do we keep security ahead of or at least level with the tech?
Something we'll all need to grapple with.
Indeed. Okay, and just a final reminder, our deep dive today was sponsored by Stonefly. They're leaders in enterprise storage, backup, and disaster recovery, AI storage, and cloud solutions.
Great solutions for these kinds of security concerns.
Absolutely. For a secure, ransomware-proof storage, think air-gapped, immutable options. Reach out to sales@stonefly.com to schedule your demo.